Good morning, I'm Amy Lynn. We all know that earlier detection of cancer gives the most hope of defeating the disease. So here to tell us more about how to detect lung cancer and share new treatments available is Dr. Keith Miller from 21st Century Oncology. Good morning, my friend.
Good morning.
Thank you so much for coming on this morning. Lung cancer hits me personally. My grandmother passed away from lung cancer, and recently one of my friends and coworkers also passed from lung cancer. And I think the common denominator was once they found out about it, it was so far advanced that there was just nothing that could be done. So I know now there's a way to earlier detect, which is major. So can you talk to us about that?
Yes, as has happened with other cancers, people are familiar with mammography and PSAs and colonoscopy for colon cancers. We've been screening for those cancers for many years, but now there's the availability of low-dose CAT scan screening for lung cancer, and that's the opportunity to catch it at a much earlier state. As you've said, most folks previously have presented with symptoms, which is usually a much later point in the disease. So for people who have a significant smoking history or other risk factors for lung cancer, doing screening CAT scans before they have symptoms is the way to try and catch it early.
Absolutely. So what are some of the signs and symptoms?
Well, I mean, the symptoms that people would have with a later stage of lung cancer would be cough, particularly coughing up blood, pains in their chest, shortness of breath, and obviously we'd like to try and find the disease before anybody has any symptoms.
Right, and the scanning is a great way to do that. So there's also new treatments available. So what is the latest treatment for lung cancer?
Well, like I said, the goal would be if we can find it really early where it's just a solitary spot in the lung, then ideally either it could be removed, or if somebody has underlying emphysema or other medical problems that would make them higher risk for an operation, we offer focused radiation treatments, which is a nice, limited, less toxic, easy way to get a lung cancer treated.
So non-operative, is that what you're talking about, the non-operative way?
Correct.
Okay.
So you know, the operations have gotten better and better through the years, and they become less invasive nowadays, frequently through tubes in the chest as opposed to a big cut on the chest.
Well, Dr. Miller, you have provided such great information this morning. Thank you so much for coming on.
Great. Thank you for having me here.
And of course, you can go to our website and find out more about what we've just been talking about by going to fox4morningblend.com.